now continue to hear the statements by delegations, which are provided under item 3, and I will turn the floor over to the Secretariat to manage this session.
Thank you, Madam President. As announced before the break, we would like to invite Italy to take the floor. Honorable Minister, you have the floor.
Vado. Madam Chair, honorable ministers, distinguished delegates, Italy aligns itself to the statement of Croatia on behalf of the European Union and its member states. Firstly, I would like to express our appreciation for the decision to convene this session of the World Health Assembly, and I want to thank WHO for the support of these months. In this period, we have all taken measures to stop the COVID-19 pandemic, and we must be ready to account promptly for our choices to our citizens and their representatives. We believe that it is absolutely necessary to start immediately, also within WHO, joint reflection on an emergency that is affecting the whole of humankind, and to develop a broader assessment of this experience. A first consideration is certainly the central role taken on by health at this time of history. It is a role that must be maintained and enforced in the future to ensure that we are prepared for the challenge to the health, security and social and economic stability of our communities. Consequently, the national ministries and the international bodies in charge of this issue will also need to enter a new season and be revitalized by extensive reforms. In particular, as regards WHO, we must ensure that it maintains and strengthens its central role, especially in times of crisis. This means that from this point forward, we need to work together to build an always stronger agency, rethinking its role and operation. At the same time, we must ensure that it is fully independent of any external influence, whether political or financial, that is only guided by science, and that is transparent in its process and fast in responding to challenges that can be complex, such as the pandemic. We should all commit to supporting this process from today, allocating appropriate human and financial resources to it, with the objective of raising the global preparedness and response capacity of individual states, with the support of the agency high-level technical and scientific expertise and solid organization at the service of all people. A fundamental challenge is the development of a safe and effective COVID vaccine. We have to fight to consider it a global public good, a right of everyone and not a privilege of few. Thank you very much.
Thank you, Italy. We would now go back to the two regional group statements that we had technical problems with in the previous session, and we would like to call Djibouti. Monsieur le Ministre, vous avez la parole.
Monsieur le Directeur Général.
Thank you. Director General, it is my honor to make this statement on behalf of the French-speaking countries group, which has observer status at WHO. To begin with, we'd like to express our deepest condolences to families and individuals people who've lost their lives as a result of the pandemic. We'd also like to express our gratitude to healthcare professionals and other frontline workers who have been demonstrating extraordinary courage and dedication in doing their jobs to help to contain the pandemic and ensure the provision of essential health services, which are a sine qua non for the smooth operation of our societies. We welcome WHO's playing a leading role in coordinating the global response to the COVID-19 outbreak. And at the same time, we welcome the efforts which have been made by the United Nations and its partners and other actions undertaken with this end in mind at regional and at sub-regional level. We are particularly grateful for what has been done to protect the most vulnerable people in our societies. Our group welcomes the initiatives which have been taken by the International French-Speaking Countries Organization to support its member states and their people in the ongoing fight against coronavirus, particularly in the areas of education, digital technology, cultural, economic and social activities. We are convinced that we can only effectively tackle and beat this pandemic through a collective, solidarity-based multilateral action founded on human rights and with a particular focus on the rights of women, whose role is absolutely essential. That's particularly the case in a time of major global crisis. We fully support the international cooperation platform to speed up development of and ensure the fair distribution of testing kits and potential vaccine, particularly for the most vulnerable countries and societies. This was recently launched and is coordinated by WHO, and is not the only initiative it's coordinating, of course, at international level. Last but not least, we encourage WHO to step up its efforts in order to ensure the quickest and smoothest possible access to the strategic documents produced by the organization in all UN official languages, and in the specific context of the COVID-19 pandemic, rapid access in those same official languages to the guidelines, protocols, advice and training courses produced by the organization. I wish you and all of us a successful virtual World Health Assembly. Thank you.
Merci, Votre Excellence. Now we proceed with the Netherlands, followed by Myanmar. Netherlands, Your Excellency, you have the floor.
Dear colleagues, it's an honor to address you as the chair of the steering group of the Global Health Security Agenda, the GHSA. The GHSA represents over 70 member states, important international organizations, and non-governmental and private sector members. Our common aim is as simple as it is difficult. We want to improve the worldwide implementation of the WHO international health regulations. And that's easy said, but we all know it's not easy getting it done. But what we know is this: it's a crucial global tool when it comes to preparing ourselves against outbreaks of infectious diseases such as COVID-19. The situation we all find ourselves in today, with lockdowns, overflowing ICUs, and our economy suffering, proves that an effective implementation of the international health regulations is more important than ever. The members of the GHSA work from the principle that solidarity and cooperation are key. And we do this from a One Health perspective, as human, animal and environmental health are complexly linked, as the current zoonotic pandemic so clearly illustrates. It's our common aim to bolster pandemic preparedness and response capacities in countries by spurring political commitments and actions, by engaging the range of sectors with equities in health security, and by drawing on expertise from across our diverse membership. We share knowledge and good practices widely. While all of us know that the best way to deal with this crisis is to stay at home, we also know that the road out of this mess is the road on which we walk together. For this, the GHSA calls on everybody to commit to specific, focused and concrete actions now, so the world will be better prepared to brave the next outbreak in the future. I thank you.
Thank you for that group statement, and we now continue with the national statements. Myanmar to be followed by Algeria. Myanmar, Your Excellency, you have the floor.
Hear me?
Yes, we do. Please go ahead.
Thank you. I'm delivering a statement on behalf of the Minister of Health and Support of Myanmar. Honorable President, Excellency, Mr. Director General, this is the time when all health ministers are busy tackling the COVID-19. Myanmar is fighting adopting this approach after adapting some of the global strategies and interventions to suit our country's scenario, given the fact that Myanmar is a developing country but with a relatively strong health system. From the very beginning, starting 5th January 2020, we have issued guidelines, standard operating procedures, do's and don'ts to prevent and control COVID-19. We take note of the fact that the virus is new. We are not fully aware of the behavior of the virus. So that's the natural history of COVID-19. We therefore need very clear-cut scientific evidences from WHO and other renowned research and health institutions like CDC Atlanta and WHO collaborating centers in the real-time basis. Sharing of experiences among neighboring countries is one of the predictors for successfully controlling and containing the pandemic. We should give special attention on the importance of psychological impact of COVID-19 on the population, let along the economic impact. At the same time, we should take advantage of conducting several relevant researches for helping us in managing and containing future pandemic. Myanmar's experience is that as the pandemic is progressing, it is clear that without proactive involvement and synchronized collaboration and coordination of the population, we will not be successful in containing the pandemic. Under the able leadership of our State Councillor, Daw Aung San Suu Kyi, Chair of the Central Committee on Prevention, Control and Treatment of COVID-19, I should say we can keep the situation under control at this point in time. In managing this pandemic of such magnitude, we should be swift in action as the interventions are time sensitive or time bound. Before concluding, Madam President, my delegation would like to reiterate our support of the One China policy in line with the UNGA Resolution 2758. We are of the view that any arrangement allowing Taiwan's participation in WHA should be guided by the One China policy. I thank you, Madam President.
Thank you very much, Your Excellency. We will now go to Algeria. Votre Excellence, vous avez la parole.
Your Excellency, you have the floor. Madam Chair, Director General, honourable participants, Algeria would first of all like to express its deepest condolences to the families and friends of the victims of the COVID-19 pandemic, and we'd like to pay a strong homage to all of the first-line workers in the fight against this illness. This pandemic reminds us of the importance of our assembly, and it shows the importance of multilateralism and solidarity and international cooperation. Since the virus appeared, multi-sectoral measures of a wide range have been undertaken by our state. They are based mainly on prevention, communication, lockdown of the areas of infection, and adoption of a national treatment protocol, as well as standardization of diagnoses. And that is important, and we have the honor to be committed within the continent of Africa with our fellow countries in strengthening the response capacities on a regional level under the aegis of the African Union and in collaboration with the WHO's Regional Office for Africa. On this, Algeria welcomes the
role of the United Nations system and the leadership of the WHO in aiming to provide a global response to COVID-19 in order to provide a global response to the virus. We also welcome the resolution on the response to COVID-19, and we fully align with it. And we hope that it will serve as a roadmap for the international community when a safe and efficient vaccine is found. It seemed to us essential that reference be made to the universal access to products and technologies which are necessary to fight against COVID-19, as well as their fair allocation and their availability at affordable prices. These are essential conditions that need to be brought together if we want to efficiently eradicate this pandemic. I could not conclude without calling on the international community for a joint global action to mitigate the economic, social and humanitarian impact of the pandemic, particularly in developing countries and those with the most vulnerable financial situations. So we are all called on to draw lessons from this pandemic in order to avoid such a catastrophe being reproduced, and the WHO will play a central role in that. And Algeria will continue to work for this end, as well as carrying out the health for all of the SDGs. Thank you. Thank you, Your Excellency.
Russian Federation. Уважаемый министр, вам слово.
Your Excellency, Minister, the floor is yours. Thank you very much, Director General. Chairman, ladies and gentlemen, we thank the Director General for his report, and we fully support the efforts of WHO to fight the novel coronavirus pandemic. The Russian Federation has taken a comprehensive set of measures which have prevented the exponential growth of COVID-19 across the country. In order to do this, we took a wide-ranging set of measures, including preventing people from going to work for 1.5 months. Furthermore, we have carried out wide-ranging testing of the population every day. 150,000 tests are carried out, and the number is increasing. We've also had a wide-ranging public information campaign. In order to provide the necessary medical help, we have provided retraining to over 1.4 million medical specialists, and we have added 130,000 specialized beds to our hospitals, including in intensive or critical care. We have also provided PPE to our staff, although I admit we had problems with that at the beginning. These measures have led us to have one of the lowest fatality rates in the world. We are also producing testing kits in Russia. There are over 20 different types at the moment. Furthermore, we're developing drugs to treat people throughout all stages of the disease, and those are already being used. We're working very hard on developing a vaccine, and we hope to start clinical trials within a month or so. We also have a national plan to ease our lockdown measures in place. The Russian Federation supports strengthening WHO's role as the international coordinating center for global public health measures. We also support it coordinating multilateral efforts to fight COVID-19. We have provided financial and other resources to WHO to help it play that role and supported the organization's work and its initiatives. Russian experts have participated in WHO country missions to fight the outbreak of coronavirus. Last but not least, we would like to underscore that only through our joint efforts will we be able to conquer this pandemic. Thank you for your attention.
La République démocratique populaire Laos.
Thank you. Lao People's Democratic Republic, please. You have the floor.
pandemic has adopted the traditional ways of living, traveling, and working, and it will stay with us for some time, if not forever. Global challenges need a global response. Do you hear me? Hello?
Yes, we can hear you. Please go ahead, Your Excellency.
Hello?
Yes, we can hear you. You can proceed, please.
Okay. Excellencies, the COVID-19 pandemic has disrupted the traditional ways of living, traveling, and working, and its global challenges need a global response. We acknowledge and thank Dr. Tedros for his key role for bringing a global solidarity to address this crisis. Low and middle income countries are the most vulnerable and need special attention and assistance. At this time, the WHO needs support more than ever to effectively carry out its critical duties on global coordination and assistance around the world. Madam President, my country is very limited resources and capacity to deal with a large number of infected people. We therefore took early preventive measures to contain infection as much as possible. We profoundly thank the valuable assistance from the friendly countries and international organizations who help us to limit the number of infected cases to 19 with no deaths. We have taken this precious time with a few cases to strengthen our hospital capacity, including infection prevention and control, and to build committee mechanisms to detect cases early. I also firmly hope that the assistance will be continued so that we can meet the SDGs and no one will be left behind. In closing, I wish more solidarity and collaboration to overcome this difficult situation and better maintain essential health services. We confirm our full support and cooperation for the success of the meeting. I do thank you.
Thank you, Your Excellency. I would now like to invite Bahrain to take the floor. Distinguished Minister, you have the floor.
بالنيابة عن وزيرة الصحة معالي الرئيس.
Your Excellencies, I am speaking on behalf of the Minister of Health, Director General of the WHO, Your Excellencies, ladies and gentlemen. First of all, I have the pleasure of welcoming the efforts that have been made on a global level, as well as the solidarity we've seen to confront the COVID-19 pandemic. This has had a negative impact on many sectors and has placed an unprecedented burden on healthcare services as well as social and economic services throughout the world. We meet today at the 73rd World Health Assembly, and we had planned to meet together and to celebrate the International Year of Nursing and Midwifery Staff. But unfortunately, we were unable to hold these events as we had planned to meet this goal of consecrating this year to these healthcare workers, and we would like to express once more all our thanks to them. So today we are here to consider the frontline healthcare staff, doctors, nurses, and all healthcare staff who have mobilized to face the challenge of this virus. Many lives have been lost because of this virus, and the medical staff have been challenged more than ever before, and their lives have been in danger. At this time, life is difficult for everyone, so we need to mobilize throughout the world to try and limit the propagation of this virus and take every necessary measure to face up to this pandemic and to rapidly find efficient treatments. The WHO should play a significant role on this in service to all of humanity. Your Excellencies, in the Kingdom of Bahrain, we have undertaken a government approach which is integrated so that we can face the challenge of COVID-19. This has an important role in limiting the spread of the pandemic, and we have highlighted a united and efficient strategy under the guidance of Prince Salman bin Hamad Al Khalifa, the Prince and Vice Commander of the Forces of Bahrain and Vice Prime Minister. He has set up a team of healthcare staff and doctors and all government bodies in order to take preventive measures and to adopt all the policies necessary for the lockdown, for mobilization and public awareness raising. Within the Kingdom of Bahrain, we have provided the necessary finance for the expansion of hospital capacity and for areas of quarantine. We have drawn up a plan for the provision of the necessary stocks for laboratory tests and provision of personal protective equipment. We have provided the necessary training to ensure that our healthcare staff were qualified. In terms of the management of treatment capacities, we've adopted protocols which have proven to be efficient within the kingdom. And we have seen the recovery of many people who were affected. We've also participated in clinical trials, Solidarity, and we've seen the results in particular in terms of the use of plasma of those who have recovered from the disease. As Dr. Tedros said, no one will be safe until we are all protected, and therefore we must continue to use every effort with the WHO to overcome this epidemic and to ensure that we cover everything. Thank you very much.
Thank you, Your Excellency. I would like to invite
Thank you, Your Excellency.
Kyrgyzstan. Your Excellency, you have the floor.
Thank you very much. I'd like to convey my greetings to all the participants in the 73rd World Health Assembly and express our gratitude to the Director General of the organization, Dr. Tedros Ghebreyesus, for having organized this virtual World Health Assembly. The COVID-19 outbreak, which was declared by WHO to be a pandemic on the 11th of March this year, is a very serious threat to every country in the world and their peoples, and it has meant that our way of life has been turned upside down. In order to prevent outbreaks and further spread of the coronavirus infection, the Kyrgyz Republic, in accordance with WHO's recommendations, has been actively working on tracking, tracing and isolating those people who have been in contact with infected people and to treat those who fall ill with COVID-19. The pandemic and its social and economic consequences may well reduce the likelihood that we will achieve the Sustainable Development Goals at the time we were set to achieve them. The government of the Kyrgyz Republic has been taking a series of measures to mitigate the negative impact of this pandemic on its economy. We believe it essential that in current pandemic conditions, we all join together and put our shoulders to the wheel in order to take coordinated, urgent measures to control and end the pandemic, and at the same time to exchange our experience and information. We can spare no effort, whether that be scientific, technological or medical, to fight what is a global problem. We are certain that with our joint efforts, using new instruments and taking note of the vital lessons we can learn from this pandemic, we will be able to appropriate health treatment and cure to our peoples. Thank you very much for your attention.
Excellency, we now call Azerbaijan. Distinguished Minister, you have the floor.
Thank you, President. Distinguished Director General, ladies and gentlemen. At what is a very important assembly session, which is being held virtually for the very first time in the organization's history, our main, if not only priority, must be to fight the COVID-19 pandemic. It is difficult to underestimate the vast amount of work that has been done to help control and reduce the effect of the pandemic by the organization and by its member states in such a short time, and also to mitigate its consequences. However, in many cases, countries have been left alone to fight this evil, and I think we all need to understand that the problems are the same in Africa, Asia, Europe, the Americas, and individual countries' problems are not just their problems, they're problems for all of us. The President of Azerbaijan made this clear in an appeal to our people. He said, "Together we're stronger," and that puts it in a nutshell. Only if we work together and implement the strategy WHO has outlined, we will be able to vanquish this pandemic. As for our country, I'd like to say that our government has taken appropriate measures to fight the pandemic, measures of several different kinds. We have taken them in order to prevent the virus getting into the country where it has. We have worked and taken measures to avoid the disease's spread throughout the country. We have been tracking, tracing and identifying infected individuals, and we've been providing appropriate medical care. As a result of all that, at the moment, we have only 3,274 patients in a country with a population of 6 million. The mortality rate has been 1.2%. Fighting this global pandemic is something that can only be done through solidarity and cooperation between countries and international organizations, especially WHO. That cooperation with international organizations and among the international community is now more important than it's ever been. We think that delegations working with the WHO have made clear today that only through joint work to tackle this pandemic we will be able to overcome it. In conclusion, let me say that strengthening and consolidating our joint efforts will be to everybody's benefit, and that will be a major achievement, perhaps the major achievement of global civilization. Thank you.
We would like to invite the Arab Republic of Syria. Distinguished Minister, you have the floor.
Thank you, Madam Chair. This session of the World Health Assembly is taking place today because COVID-19 has prevented us from meeting traditionally. And we'd like to talk about the essential principles of the United Nations, those of solidarity, international cooperation in the face of global challenges. We must avoid politicizing the work of this organization, in particular at a time when the world is suffering from a pandemic which will have a medium and long-term effects. In Syria, our health workforce are bravely facing up to the pandemic and the circumstances which are the consequences of the social and economic war which is waged against our country and has been for 9 years. The economic sanctions, which are coercive and unfair, have been impeding the capacities of many essential services, in particular healthcare services. Today, when countries which have solid healthcare services are struggling to fight this pandemic and save the lives of their citizens, we can see the United States of America and European countries persisting with the coercive measures against Syria and continuing their inhuman blockade, which damages our capacity to respond as a healthcare system and preventing the healthcare system from having access to preventive, diagnostic and treatment products. So we call once more on the removal of these measures so that we can ensure the health safety of our citizens, whatever their situation. Ladies and gentlemen, this healthcare situation in Palestine and in particular those detained in prisons in occupied territories are extremely serious, and we'd like to condemn the brutal measures to which they are subjected today. We call on the United Nations and other agencies to call against this, and we'd like to also mention the principle of a single China. Thank you.
Thank you, Your Excellency. We would like to give the floor to Nauru. Distinguished Minister, you have the floor. We have small technical problems. We will come back to Nauru later. I would now like to invite Uganda. Distinguished Minister, you have the floor. We will proceed to Mozambique now. Votre Excellence, vous avez la parole.
Excellency, you have the floor.
On behalf of His Excellency Minister of Health of Mozambique, Dr. Tiago, Madam President, Honorable Ministers of Health, Director General of WHO, distinguished delegates, Mozambique aligns itself with statement presented by Congo on behalf of the African Group. It is with great honor that I address this assembly, and I would like to start by congratulating the Director General of WHO and his team for the leadership and technical support provided to prevent and combat this pandemic. Allow me to convey a message of encouragement from His Excellency Filipe Jacinto Nunes, President of the Republic of Mozambique, and the government for the efforts made by the United Nations agencies, in particular the WHO, in responding to COVID-19. It is with that value of this support that Mozambique still registers a relatively small number of COVID-19 cases. We are convinced that if we continue to work with all stakeholders, including communities, we can break the chain of the infection transmission. Until today, Mozambique registers 145 cases of COVID-19 with no deaths, and is following all the protocols from WHO regarding prevention, health promotion, diagnosis, and treatment. We take this opportunity to thank all the health professionals from all over the world, as they are the main front line in this titanic struggle. Finally, we reiterate our commitment to continue to make coordinated efforts to overcome current constraints and call for the need to strengthen the implementation of the global strategy on public health action plan and innovation, attributing greater investment in research and development, which can contribute to discovery of drugs and vaccines against COVID-19, and thus to improve the health situation of our communities. I thank you for the attention.
Thank you, Your Excellency. I would like to read out the 10 following countries on our speakers list. It will be starting with Qatar and then following with Luxembourg, Barbados, Niger, Paraguay, Portugal, Armenia, Mali, Iceland, Lithuania, and Latvia. Qatar, distinguished minister, you have the floor.
Your Excellency, Madam President, Your Excellency, WHO Director, Your Excellency, ladies and gentlemen, Qatar has addressed the COVID-19 threat with a whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activated extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the pandemic, and we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intense testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic, 5%
Your Excellency, we have some technical problems. We lost you. Can you start again, please?
Sure. Is it clear now?
Yes, please. Go ahead.
Would you like me to start from the beginning?
Yes, you can.
Okay. Your Excellency, Madam President, Your Excellency, WHO Director General, Your Excellencies, ladies and gentlemen, Qatar has addressed the COVID-19 threat with a whole government, whole society approach. Continuity plans were put into action to ensure that our everyday activities, the businesses and society at large, function as normally as possible during this pandemic. In order to control the spread of the disease in the community, we activated extensive community surveillance systems to detect clusters and respond promptly with control measures. We are still in the exponential growth phase of the epidemic as we are reaching our peak. The number of cases reported is high, 11,600 per million, but as documented throughout the world, this is in great part due to our intensive testing policy and case finding, which allows us to detect a larger fraction of positive individuals than usual. Currently, 94% of our positive cases are mild or asymptomatic. 5% require hospitalization, and only less than 1% end up in the ICU. We have seen very few deaths among patients with COVID-19. Our case fatality rate is currently 0.5 per 1,000. We believe that this picture, different from that of a number of other countries, is attributable to several factors. The overall young age of our population, the active search for cases through an intense testing program. We have tested approximately 56,000 persons per million, and a very efficient and effective healthcare system which diagnoses and treats the most severe patients early enough to improve their course of disease and decrease complications. To prepare our healthcare system to respond to the challenges posed by the epidemic, we activated our contingency plan to increase our capacity in infrastructure, manpower, and resources to deal with any anticipated surge required as a result of increase in demand. We intensified our relevant training programs and ensured that our staff have the necessary PPE for their safety. And to ensure that all our patients are taken care of and not overlooked while we are fighting COVID-19, we transformed our healthcare services, primary elective care, and particularly for those with chronic diseases, are assisted virtually to ensure that this vulnerable group of population have continuity of care. Your Excellencies, ladies and gentlemen, our Emir, His Highness Sheikh Tamim bin Hamad Al Thani, recognizing our responsibility towards the global community, has directed that respective authorities, Qatar-based institutions, should provide all possible global support to the people and countries impacted by the COVID-19 pandemic. As a result, Qatar Airways has carried around 1 million global citizens back to their home countries, as well as repatriated thousands of travelers stranded by coronavirus aviation shutdown through chartered flights. Qatar Fund for Development has also provided around 132.5 tons of medical aid to 13 countries so far. In this regard, we believe that universal, timely, and equitable access to and fair distribution of all quality, safe, and efficient and affordable essential health technologies and products should be ensured in line with the Doha Declaration on the TRIPS Agreement and Public Health. The State of Qatar has also recently co-launched alongside South Korea, Canada, and Denmark, and Sierra Leone in a virtual event at the United Nations headquarters in New York, the group of friends of solidarity for global health security to combat the coronavirus pandemic COVID-19. We call on all countries to join us in this initiative, and we thank WHO. Thank you, Your Excellency.
Thank you, Madam Minister. We go to Luxembourg now. Your Excellency, you have the floor.
President.
Thank you, Chairman. Chairman, Director General, Your Excellencies, ladies and gentlemen, Luxembourg aligns with the statement made by the European Union and its 27 member states. We deplore the tragic losses in human life and the suffering being undergone by countries around the world as a result of this unprecedented health crisis. We express the strongest possible support for multilateralism, the role played by and leadership shown by the WHO in its response to this pandemic. And we'd also like to thank the Director General and his team and the entire WHO staff for their tireless efforts to contain this pandemic. We must put on record our recognition for the fundamental role played by healthcare workers in this crisis. They have paid a very high price in their daily mission to save lives. We would also emphasize the need for safe and effective development of a vaccine against COVID-19. When we get one, it must be fairly accessible to everyone and available at a reasonable cost because it will be a shared global good. We emphasize the need for an approach based on human rights, leaving no one behind, and underscore the urgent need to protect health and maternal, sexual and reproductive rights. As a reliable and flexible partner of WHO, we feel the need to increase our obligatory and voluntary contribution to the organization and to its member states so as to turn around its situation of chronic underfinancing. We would also like to see more transparency in sharing information as part of our overall response to the crisis. Our priority is and must remain the testing of all individuals to ensure proper tracing and identification of anyone carrying the virus. Such people must be quarantined once tested positive, as must their close contacts, and this, together with barrier measures and social distancing, will help us to contain the pandemic. Last but not least, we support an independent evaluation of the crisis management once the crisis is over. International cooperation, solidarity and joint action are more essential now than they've ever been as we tackle this pandemic. We trust that we will overcome this crisis if we work closely together. Thank you.
Merci, Monsieur le Ministre.
Thank you, Minister.
The Minister from Barbados, you have the floor.
Honorable delegates, Barbados has set out on the journey to strengthen its health systems in the face of and in response to the relentless COVID-19 pandemic. Within a few short weeks of the first cases being reported in China, we immediately set up our Health Emergency Operations Center to guide the implementation of a suite of strategies aimed at preventing or delaying, detecting, suppressing, and containing the transmission of COVID-19 in Barbados. Key highlights of our response have included procuring urgently needed medical equipment and supplies in an environment of global scarcity, strengthening the infrastructure of the healthcare system, including laboratory capacity for the diagnosis of COVID-19. We are cognizant of the ongoing health needs of our people and are determined to not be paralyzed by this pandemic. We must continue to adequately address all the pressing health concerns, ranging from NCDs to maternal child health issues and to disaster preparedness, to mention a few. Barbados will continue to work on understanding the social, economic, and political impacts of the current crisis and to craft strategies to mitigate them with sustainable, resilient, and rights-based solutions involving an array of actors with a whole of society approach. However, implementing comprehensive health strategies aimed at suppressing transmissions and preventing them from spreading, along with focused efforts on linkages between health systems and health security, requires sustainable resources. Despite our country's designation as a high-income country, we and other similarly vulnerable states urgently need global support and solidarity to ensure the continuity of essential health and social services to safeguard the health and well-being of our people. We remain appreciative of the efforts of WHO, PAHO, and the Caribbean Public Health Agency, CARPHA, in providing unwavering assistance and stewardship to Barbados and our partner countries in the Caribbean region as we aim to improve the health and quality of life of all of our people. I thank you, Madam President.
Thank you, Honourable Minister. I would like to invite Niger to take the floor, followed by Portugal.
Madam President.
President, Director General, distinguished delegates, ladies and gentlemen, may I first of all convey to you the warmest greetings and congratulation of the President and the other staff members of the President's office. We'd also like to congratulate you on your elections. And I'd like to conclude these preliminary words by congratulating Dr. Tedros Ghebreyesus and the WHO staff for organizing this session in particularly difficult circumstances. We're grateful for their dedication to carrying out their mission despite the circumstances. Since December 2019, the entire world has been facing the coronavirus pandemic. The health crisis it has brought in its wake has had massive social and economic consequences and, of course, health consequences, and we haven't yet managed to get a full picture of how large they will really be. We registered our first case on the 19th of March, and since then 876 cases were notified, with unfortunately 50 deaths. We drew up an early preparation and response plan, which was financed by the state and its technical and financial backers. We need to be vigilant in tackling the impact of the infections and managing them. This crisis has hit us in a context where our health systems were already weak and where we also face major security problems in the Sahel region. We urge that the international community assist us financially and in other ways so that we can better tackle the effects of the pandemic and indeed the effects of other emerging diseases in our countries so that our health system can cope. I would like, in conclusion, to thank WHO and other bilateral and multilateral partners that we have for the multifaceted assistance they have given us to prevent and manage the pandemic. That helped us come at the time when we need it most. We welcome the ACT initiative taken by WHO and her partners to work on the development, production and equitable distribution of vaccines, diagnostic kits and drugs to treat COVID-19. We urge the international community to mobilize around WHO and support it so that this initiative can be brought on stream as quickly as possible and fully supported. Thank you. Thank you, Minister. I now give the floor to the delegation of Portugal. Your Excellency, the floor is yours.
Director General, dear colleagues and delegates, when we met a year ago in Geneva, it would have been difficult to imagine that the next World Health Assembly would take place in these circumstances. The COVID-19 pandemic changed our lives, and its impact and consequence will continue to be made felt for quite some time. It reminded us of the importance and central nature of public health and how important and transversal its implications are on society. It also showed us that no country is completely prepared to face such a threat and how we need and depend on one another. Before underlying a few of the main lessons of the pandemic, I'd like to give some thanks. First of all the healthcare professionals and the other healthcare and other professionals who were at the front line. Then I'd like to thank society in general, and please allow me to particularly thank the people of Portugal for their responsible manner in responding to lockdown and other rules for the slow retaking of societies and normal life. The United Nations has taken its role very seriously, and in particular I'd like to highlight the role of the WHO. And finally, I'd like to thank the scientific community for their efforts and mobilization for research and development of treatments and vaccine. The fight against COVID was a priority for the government of Portugal, and as part of this, human rights were very important during the state of emergency. We made regularization of temporary regularization for the status of all migrants, refugees and asylum seekers, ensuring that they had the same services as Portuguese residents, so that they could have access without discrimination to health and social services. We also ensured that we worked on having social support for workers and the most vulnerable societies. And it's also something I'd like to finish with, that it's important that we invest in strengthening healthcare systems and universal health coverage. And this will take place through a strong public health architecture on a global level, which is coordinated and shows solidarity and transparency. Thank you.
Thank you, Madam Minister. Now I'd like to invite Armenia. Your Excellency, you have the floor.
Honorable President, Director General, Ministers, Excellencies, distinguished delegates. We thank the WHO for convening World Health Assembly at this critical time. COVID-19 pandemic is spreading worldwide. This session is not only the first visual meeting of WHA, but also the most important one to understand where we are and discuss further way forward in implementing our joint approach to response to COVID-19 nationally and globally. It is my honor to represent the Republic of Armenia by the delegates in the fight against COVID-19. Every single day of the past months, every single hour, we engaged ourselves in a battle wrapped in uncertainties. The path of our response to the side may seem like a walking in the dark. But the good news is that the strategies of early detection, isolation, testing, contact tracing, and quarantine, along with physical distancing, have shown to be critical elements to slow the disease transmission. Dear colleagues, the COVID-19 pandemic pushed many of us into new realities. But one thing is clear for now. Priorities have not been changed, and became bolder. Let me summarize 4 lessons learned. First, the COVID-19 outbreak revealed gaps in our systems, but also showed our strengths developed from the valuable experience responding to other health threats. The epidemic proved that health is one of the most important priorities of all governments. Second, emergency preparedness is a core for effective response and containment of the epidemic. Armenia has the wealth of experience in implementing agile emergency capacities, but we should certainly revise the approach to implementation of unified measures and communication. Third, beating NCD is also at the core of COVID-19 response. Epidemic hits the most vulnerable with NCDs. Therefore, we should continue focusing on prevention, early detection, and management of NCDs to prevent the onset of this disease, neither struggling to save their lives during any epidemic. Fourth, as COVID-19 continues to spread around the world, ultimately, the fight with the pandemic requires new tools, more research, and innovation at global level. Pandemics of this magnitude do not respect borders. Therefore, they require global action to counter and overcome the crisis. Indeed, the national community, regional cooperation, and global solidarity are essential to these efforts. I thank you for your attention.
Thank you, distinguished minister. Would like to invite Iceland to take the floor. Your Excellency, please go ahead. You have the floor.
President, Director General Dr. Tedros, honorable ministers, distinguished delegates. Iceland would like to thank WHO for its guidance and leadership in combating COVID-19. The pandemic concerns us all. A global platform like WHO is important when fighting a common threat. In Iceland, we have followed WHO guidelines and leadership. We have been able to delay and prevent the spread of the virus, safeguard our healthcare system, and protect our population. The Icelandic healthcare system has endured the pressure of the pandemic. We have managed to build a strong and resilient public health system that is both flexible and adaptive. The lessons we have learned will be useful when planning for the future. The outbreak is causing unprecedented crisis with increased unemployment and insecurity affecting people all around the world. We need to monitor the impact on people's mental health and well-being, protect our social infrastructure, and ensure that no one is left behind. Attention must be made to vulnerable groups like women and children, as well as the populations of the developing countries. We are still in the middle of the pandemic. Continued global solidarity is essential. This includes collaboration in research and in the development of a vaccine against the virus. We live in a community of nations where we share common goals, which we recognize as the UN Sustainable Development Goals. Let's make these goals guide us on our way forward, building on the principle of leaving no one behind.
Thank you, Your Excellency. Would like to invite Lithuania. Your Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Lithuania fully aligns itself with the statement made by Croatia on behalf of EU and its member states. Today, the world is facing the unprecedented challenge posed by COVID-19 pandemics, the challenge we have never faced before in our lifetime. The pandemics has a significant impact on the health systems, economies, livelihood, and well-being of the societies, and adversely affects the exercise of human rights all over the world. We cannot win this war standing alone. Only by adhering to the principle of effective multilateralism, only by working together, we are stronger and more effective. Only solidarity and unity will help to effectively respond to this fast-growing threat. We emphasize the need for the global leadership in coordinating joint international efforts and actions. Therefore, we recognize and appreciate the leadership and efforts of the World Health Organization in supporting and guiding member states as they fight the pandemics. We also recognize the importance of research and development, including the development of vaccines and their accessibility and affordability, diagnostics and treatment, as well as the availability of personal protective equipment equitably to all population groups. Lithuania reacted very rapidly to the extent of the spread of the virus in the world and the threats posed by it to human health and life, and has taken effective measures to contain the virus from spreading. Lithuania remains committed to working together with the international community in responding effectively to COVID-19 crisis. Thank you.
Thank you, distinguished Minister. We would now like to invite Latvia to take the floor. Your Excellency, you have the floor.
Distinguished Director General, Excellencies, ladies and gentlemen, Latvia aligns with the statement of the European Union. Currently, due to COVID-19, the whole world is undergoing a challenging time that tests not only the national health system's capacities, but also society's physical and mental health. The virus has affected all possible sectors, but there is no time to mourn the losses and adversity associated with COVID-19. This is time toward finding solutions to the current challenges, to evaluate response actions, draw conclusions on which measures work better than others, and to move forward with renewed vigor into the future. Latvia is one of those countries where the response to COVID-19 was very well managed. It is due to the hard work of our epidemiologists who studied each case very thoroughly, tracing the cases and contacts. We have applied the whole government approach following closely the epidemiologists' advice. We have dedicated health workers. Population has followed sanitary guidelines. It has been a common effort. The first lesson that we learned was that the evidence-based approach is the best. Latvia highly evaluates the contribution, support and guidelines of the World Health Organization and its coordinated approach not only in the initial stage of COVID-19, but also now in the transition phase. Latvian government also supported the work of WHO by a voluntary contribution to the Strategic Preparedness and Response Plan. Undeniably, COVID-19 is a painful experience for the whole world. It has shown the need for coordination and international cooperation transcending national boundaries. Latvia believes that only together and united in solidarity we can overcome challenges and prevent future pandemics. Thank you.
Thank you, Madam Minister. We would like to invite Kazakhstan. Your Excellency, you have the floor.
President, Director General, on the behalf of the Ministry, it is my great pleasure to address you at the 73rd session of the World Health Assembly. I would like to express our gratitude and full support to the World Health Organization and its Director General, Dr. Tedros, for leading role in the combating of COVID-19. We thank WHO for all technical guidance in the preparedness, readiness and response action to COVID-19. Kazakhstan has taken tremendous effort to contain the spread of COVID-19, and now we are focusing on transition by mitigating restriction measures. At the same time, we are taking actions to robust the health system for the possible wave by integrating primary health care into the overall public health response to COVID-19. The role of PHT is crucial in informing patients and community about the COVID-19, interrupting the chain of transmission and identifying vulnerable populations, as well as ensuring appropriate referral for home isolation and hospital admission. The other important issue is a broader use of digital technologies and development of a digital health ecosystem, which provide us new possibilities during the challenging time for the COVID-19 pandemic. Digitalization of public health surveillance, laboratories, and PHT has been playing an important role in Kazakhstan in timely and right action. On the last session of WHO Executive Board, Kazakhstan initiated the decision on primary health care to adopt the operational framework on the PHT that was supported by all member states. I once again want to highlight the importance of strengthening primary health care, which is playing a major role in the eradication of current pandemic and prevention of other infectious diseases. We need to stay on track of the principles of UHC and PHT. Dear colleagues, the whole world, international organization, and other stakeholders need to combine efforts to provide people with safe, effective, and affordable vaccines, tests, and treatment. We express our highest appreciation and support to the dedication, effort, and sacrifices of all healthcare professionals, health workers, and other frontline workers. Only together we can win. Thank you.
Thank you. We would like to invite Morocco. Your Excellency, you have the floor.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين أصحاب الفخامة.
In the name of God, the Merciful, ladies and gentlemen, WHO Director General, distinguished ministers, a very good evening. The COVID-19 pandemic is a major challenge for us all, and it's unprecedented since the Second World War. It has a major social, economic and political impacts, and as a result we need to take action in order to contain the pandemic. Therefore, we need to see the WHO playing an essential role, and WHO, through its Director General, is playing that leadership role. We are facing this COVID-19 pandemic, and Morocco is doing its bit to take measures to try to contain the pandemic. And we have made the health of our people our primary focus. We've been focusing on creating the conditions for social peace and trying to support the economy as well. So we are all working together to try and manage this as well as we can. We have imposed measures regarding quarantines, regarding social distancing, the closure of public spaces as well. And we have strengthened our infrastructure, in particular in the healthcare system. We've stepped up the health capacity, quite apart from the preventive measures that we've been taking to protect women and other vulnerable groups in the population. We are also focusing on trying to ensure the accessibility of protective equipment and other medical products. Ladies and gentlemen, the international community needs to share its experience and knowledge regarding essential medical products. That's the only way in which we are going to overcome this pandemic. Thank you very much for your attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister. Romania, Your Excellency, you have the floor.
Honorable Chair, Director General, Excellencies, Honorable Ministers, Romania fully aligns itself with the European Union statement. The COVID-19 pandemic brought us together today in a virtual format. The same exceptional circumstances have called upon us to come together to show resolve, commitment and solidarity. The coronavirus knows no boundaries, no social status, religious belief or political preference. I would like to express my deepest sympathy to all the families of the victims of this unequal battle, with a special thought for all those on the forefront of the fight against COVID-19. I'm confident that we will emerge stronger from this dramatic crisis, but to do so, we need a coordinated and human rights-based approach. I would like to thank World Health Organization for the constant and qualified support to member states, demonstrating leadership as coordinating authority in this time of crisis. Romania's national containment strategy has used a comprehensive approach of identifying, testing, tracing, isolating and treating infected persons. Romania, as most states, faced difficult decisions in responding to the pandemic. Lockdowns, closure of schools, restrictions on services, physical distancing, border closures with a significant socio-economic impact. Our citizens deserve our appreciation for respecting rules and coming together in this very difficult time. This crisis can and should be an opportunity to build a more resilient world by thinking and acting at a global, regional and national level. We need to partner in order to develop and to ensure equitable access to safe and effective medicines and vaccines against COVID-19. Thank you.
Thank you, Honourable Minister. I would now like to invite Ireland. Your Excellency, you have the floor.
Yes. Thank you. Honourable Chair, distinguished Director General, distinguished guest delegates. Ireland aligns itself with the statement delivered by Croatia on behalf of the EU and its member states. In the COVID-19 pandemic, we are facing global challenges unlike anything seen before in our lifetime. I wish to pay tribute to all healthcare workers serving on the front line, in particular, those who are doing so in humanitarian settings. They are showing extraordinary courage and dedication in their efforts to respond to this virus, and we call for their protection to ensure them around the world. In the International Day of Nurse and Midwife, we also recognize the special contribution of our nurses and midwives, who account for half of the world's health workforce and are playing a critical role in our response to COVID-19. Ireland strongly supports the WHO, believes that the UN is the most central for global response across the three pillars of development, human rights, and peace and security. Should Ireland to the Security Council for the 2021-2022 term, we will work for the leadership and engagement expected of the Security Council at this critical moment. As we work towards effective treatment and a vaccine, we must ensure that there is equitable access to vaccines, diagnostics, therapeutics and equipment in line with our commitment to the 2030 agenda to leave no one behind. Ireland will continue to act in solidarity to help around the world and has already allocated more than 78 million euro to the global COVID-19 response, including a fourfold increase in our WHO contribution this year. I am also conscious of the importance of maintaining the range of essential health services at this time, including immunisation and also the priority of strengthening resilience in our health systems to build back better. Ireland stands ready to work with the international community to put an end to this crisis as soon as possible. As we say in Ireland, "Niart go cuairla céile," or there is strength when we come together. Thank you, Chair.
Thank you, Madam Minister. Would now like to invite Pakistan. Your Excellency, you have the floor. We have some technical problems. Pakistan, we will continue to Cambodia. Your Excellency, you have the floor. Your Excellency, we can hear you. Please continue.
Pakistan. Honorable Presidents, Honorable Dr. Tedros, Honorable Ministers, distinguished ladies and gentlemen, today I'm truly delighted and extremely honored to have been invited to address this considered World Health Assembly on the topic combating COVID-19. On behalf of the Royal Government of Cambodia and my own behalf, I would like to express my deep appreciation for the invitation extended by His Excellency Dr. Tedros, Director General for the World Health Organization. COVID-19 shows Cambodia is a small country with a big heart. Cambodia has been calling for global and regional solidarity. No one country overcome the COVID-19. Cambodia has been recognized globally for the management of the Western cruise ship Haven in February 2020. The decision by the Prime Minister of Cambodia chose to accept the partnership in Cambodia that was running short on supply to being turned away from several parts of the world. In collaboration and coordination with the World Organization, WHA73 and Stupid Board and other partners, we are making effort in managing the screening, quarantine, blood testing, onward transfer of passengers and crew members. Cambodia and managing the Western cruise ship event have highly appreciated relations and work. At the time, the common health by COVID-19 require life, solidarity, and vital cooperation more than ever. I believe that the World Health Organization and UN special agencies should handle the question related to Taiwan and according to the One China principle set for Resolution 2758 of the UN General Assembly, the Resolution 25.1 of the World Health Assembly. Cambodia respects the decision of the Republic of China and set up matters. Since the first case expected on 27 January, Cambodia made our heavy effort to rapidly respond to all 100 confirmed cases with no death and 102 recovered today. We did not have any new cases for more than 1 month. However, in our high vigilance, we are currently adjusting our public health and social measures through wise approach to maintain social economic continuities. Cambodia's development master plan 19 with 9 priorities. One, incident management and planning, second, surveillance and research assessment, 3, laboratory, 4, clinical management and healthcare services, 5, infection prevention and control, 6, non-pharmaceutical health material, 7, risk education, 8, point of entry, 9, operational logistics. Your Honorable Minister, National Committee to Combat COVID-19 has established and led some major cameras and operations. The Prime Minister of Cambodia, then the International Committee to Combat COVID-19, lead Prime Minister has played a role and leading and coordinating the presentation and playing a role and responding, leading, coordinating the implementation measures across the whole of government and whole of society, including screening, quarantine, contact tracing, pharmaceutical and reducing and their own setback, as well as supporting communication and messaging, health measures for communities, addressing the social and economic impact and ensuring business continuity with strongly support by the provincial communities to combat COVID-19 at the subnational level. Good progress has been made in the implementation of the master plan. Funding has been mobilized from the Royal Cambodia Development private sectors and civil society, national hotline investment team, capacity, testing, and hence new physical distancing measures like schools closure, mask closure, and other technologies to reduce transmission. Health facilities have and upgrade to manage COVID-19 patients with health workers
Excuse
on
me.
case management and infection prevention.
Excuse me, I would like to interject here. My apologies, but the distinguished delegate has far exceeded the allotted time. He needs to wrap up, please.
And many countries now have been supporting Cambodia in fighting against COVID-19 today. Finally, I wish you as head of the delegation, delegate, ladies and gentlemen, good health and success in the deliberations.
Thank you, Honourable Minister. Would like to invite New Zealand. Your Excellency, you have the floor.
This crisis has reinforced the critical importance of healthcare and other essential workers, as well as global cooperation. New Zealand has looked to the information and experience of others to help shape a response appropriate for our own national context. We've also been open to sharing our experience in the hope that it will benefit others. Our relationship with the Pacific is particularly important in this respect. In looking to the future, we will be able to save lives, communities and economies if we commit to building on the strengthening of global relationships and mechanisms. In this respect, New Zealand is pleased to co-sponsor the resolution on COVID-19. We very much hope that all member states join with us in taking the steps towards a new era of global solidarity. It is vital that we uphold principles of non-politicisation and inclusivity when we come together at the international level. There is much work ahead, and New Zealand stands ready to work alongside the WHO, other member states and organisations. This experience has reinforced the critical role of the WHO, and we have borne witness to the excellent support provided to our neighbours in the Pacific, as well as using WHO's technical products nationally. In New Zealand, we will continue our focus on protecting the most vulnerable in society. As part of this, we recognise that people will experience differences in health and well-being that are not only avoidable, but that are also unfair and unjust. In the context of COVID-19, addressing equity means protecting older people and those with underlying conditions. It also means actively focusing on and mitigating any risk that this situation will further exacerbate the inequalities experienced by Māori and Pacific peoples in New Zealand.
Thank you, Honourable Minister. I would like to invite Cyprus. Your Excellency, you have the floor.
Of the world. On behalf of the Republic of Cyprus, a small island of 900,000 citizens in the Eastern Mediterranean, a member of the EU, it is my pleasure to address you today on the 73rd World Health Assembly and to express our gratitude to the World Health Organization for showing its global leadership in these unprecedented times. Cyprus aligns itself with the EU statement delivered by Croatia on behalf of the EU and its member states. Furthermore, we are grateful for the leadership role of the Director General of the World Health Organization. Today, we are united in a common goal of fighting the invisible, ruthless enemy of the COVID-19 pandemic, limiting its devastating impact on global health, economies, and social order. Today is an opportunity to stand back and take stock of what we have achieved so far, what lessons are there to be learned, and what we need to do in the future to win the war against COVID-19. a gateway between East and West and a popular tourist destination, Cyprus has always enjoyed huge movement of people to and from the island. From the outset of the pandemic, Cyprus has closely followed recommendations from WHO. Since March 9th, when the first 2 imported cases of COVID-19 were identified, as of today, 905 total cases have been reported. 401 of these cases have recovered. 1 in 5 cases out of 5 cases are healthcare professionals, and unfortunately, 17 deaths have occurred due to COVID-19. In the last weeks, the curve is finally flattening, and the number of new cases now is in single digits every day, and the ICU bed capacity is less than 5%. Cyprus has one of the highest uses of diagnostic testing, with more than 8,000 per 100,000 people, and our policy is to test early, contact tracing, and isolate. Our success in dealing so far with this pandemic is based on the following. First of all, there was and still is strong political commitment to take robust and proactive measures in line with WHO guidance to protect citizens from the spread of the COVID-19 pandemic. We did not hesitate to take hard measures early on, always in line with the guidelines of WHO and ECDC. As of February, we took measures at our entry points, monitoring passengers according to their country of origin. We implemented social distancing measures and actively educated our health professionals and the public as well. We declared a state of emergency on the 15th of March and allocated €100 million emergency fund for strengthening of our healthcare system. We proceeded with the establishment of public health clinics for assessment and management of suspected cases of COVID-19 and opening of helplines for the public and health professionals. At the same time, we imposed strict lockdown measures that restricted the movement of people, adopting a lockdown stay-home policy with curfews, with penalties for non-adherence and closure of all non-essential businesses. Furthermore, we have restricted entry to the country to only Cypriot nationals who, upon entry, they undergo a PCR test and are quarantined for 14 days in hotels monitored by the government with the assistance of the Ministry of Health. Great emphasis throughout this period was placed in the rapid identification of new cases through early testing and active contact tracing, isolation of suspected or symptomatic cases for 14 days, and self-isolation of close contacts. Furthermore, we engaged in random sampling and testing of the population, but also the frontline workers and healthcare professionals and vulnerable groups. Further actions were taken to protect vulnerable groups through stay-at-home policies and home deliveries. At the same time, we placed great emphasis on continuous monitoring of personal protective equipment and controlling and procuring stock, equipment and necessary consumables, and last, we actively trained staff in the proper use of personal protective equipment. We took measures to increase the capacity of healthcare system through mobilizing staff, decree of requisition of healthcare professionals,